Hi, I'm John Musali. I'm a practicing emergency physician and the CEO of TraumaLink. TraumaLink is a social enterprise that will harness the power of communities to provide pre-hospital trauma care to victims of traffic injuries. We'll create a hotline that connects patients with trained first aid volunteers and emergency transportation, while at the same time creating attractive advertising opportunities for the private sector. Let me start by telling you a story about Amir. Amir is 25 years old, and he's the primary breadwinner for his large extended family. One day while he's walking to work, along the side of the road, a driver suddenly swerves around a tractor and hits him. Now fortunately there's somebody there who has a cell phone, but he's not sure who to call, and by the time he arranges for transportation and they figure out where to send Amir, an hour has already passed. Now his injuries weren't initially that severe, but as more and more time goes by, he's beginning to wonder what will happen to his family if he doesn't make it. When they arrive at the small local hospital, the doctors really can't do much more than give him IV fluids and put bandages on some of his wounds. And at this point, Amir's condition is becoming pretty serious as he slips into the early stages of shock. By the time he's put back in the car and taken to another hospital with an available surgeon, he's already critically ill from blood loss, and he dies in the emergency room before he even makes it to the operating theater. In the coming months, his family is forced to sell their land to pay for his medical bills and also for food. And without a source of income, they're plunged into severe and long-lasting poverty. Unfortunately, this is a story that's played out in Bangladesh many times per day, all over the country. When the three of us were there in January, it was just impossible for us to ignore what a huge traffic problem the country has. And we learned that there were over 20,000 traffic fatalities and 400,000 injuries, making these some of the most dangerous roads in the world. What's especially frustrating for us is that many of these victims are young and they're otherwise healthy, and they're dying of preventable causes, things like unrecognized airway obstruction, uncontrolled bleeding. The death of a child or a breadwinner invariably has profound, widespread, and multi-generational effects in a society that relies so heavily on family and community ties. As you've seen from Amir's story, there's no hotline number for people to call if there's a crash with injuries. But what if there was? Most of the care that's being provided to trauma victims is by other road users with no formal medical training. But what if there were people who could arrive quickly and knew exactly the right thing to do? Right now there's a lot of confusion around where to send badly injured patients. But what if there were people who knew exactly where to send those patients based on their location and the severity of their injuries? What if there was TraumaLink? Let's go back to Amir's story, but this time with TraumaLink in the picture. Amir is walking along the side of the road and he's struck by a car. But this time the person with the cell phone sees a TraumaLink billboard and calls our hotline. He's connected with one of our trained volunteers who quickly locates where the call is coming from and also identifies how badly injured Amir is. A trained first responder arrives quickly and immediately gets to work stopping Amir's bleeding. And when the car arrives, the driver already knows where to take Amir and the best way to get there. And that operator stays on the line until she knows that Amir has arrived at his destination and that he's safe. And this time Amir survives his injuries, and his village has a new hero tonight. As you can see, TraumaLink provides a reliable hotline that people can call if there's a crash with injuries. We reduce delays in treatment time by dispatching trained first responders from nearby communities and providing guidance on transportation to the nearest appropriate medical facility. We know that these interventions reduce the time it takes for patients to get the care they need, and every minute we save increases the chances that they'll survive to have long, satisfying, and productive lives. Today we'd like to tell you why TraumaLink is the right solution for this problem, how we're uniquely positioned to implement this solution, how we'll make this venture scalable and self-sustainable, how we're anticipating and mitigating potential risks, and why you should invest in us. To give you more details on how we'll put all of this into practice, I'll turn things over to our Chief Operating Officer, Eric Dunapace.
Thanks, John. Hi, I'm Eric Dunapace. I'm going to tell you about how TraumaLink will work and why we're the team to lead it to success. So, our service model will rely on 4 sectors, each supported by industry-leading local partners. For the first area, call center operations, we will have a paid full-time staff of operators available 24 hours a day, 7 days a week. When someone calls, they'll be able to determine where they're calling from and also dispatch our volunteer first responders to that location using an automated process and our database of volunteers. Moreover, they'll also be able to summon transportation services and then direct them where to go to based upon a person's injuries. To help us succeed in this endeavor, we've partnered with Empower, one of the first mobile health technology companies in the entire world. Their on-the-ground knowledge and local expertise will ensure that we are able to set up our call center rapidly and efficiently. Of course, this will rely on a pool of volunteers, which covers the second area of our service model, trauma training. We are relying on an already established curriculum developed by our own Dr. Musali and used by the Harvard Humanitarian Initiative. And once our volunteers are trained, they go into that database you just heard about. And to help us succeed in this endeavor, we have formed exclusive academic partnerships with 3 major Bangladeshi universities. Utilizing their already existing training programs and educational networks and a train-the-trainer type education program, we'll be able to rapidly train a large number of volunteers. Which brings us to the third sector, community engagement. So how do we know that people will use our service and volunteer to become first responders? First, we'll have public awareness campaigns through traditional media and word of mouth, but also, based upon a strong existing relationship between Empower and Nokia, all Nokia phones sold in Bangladesh will come pre-programmed with our hotline number. Moreover, we have partnered with several local NGOs, including BRAC, the largest NGO in the world. No other organization has the same acceptance in Bangladesh that BRAC does, and by partnering with them, we've guaranteed ourselves a unique recognition and acceptance in the local communities of Bangladesh. Which brings us to the last area of our service model, private sector advertising. Now that we've already established relationships in the first 3, we've begun reaching out to partners in this 4th area. Imagine, you're a company hoping to gain an edge in the substantial rural market of over 100 million potential customers in Bangladesh. What better way to do that than advertising through TraumaLink, an organization that saves lives? By giving us sponsorship fees, organizations such as Grameen Phone, GSK, Nirvana Group, and Square Pharmaceuticals can help build socially conscious brands through advertising on billboards, posters, car stickers, and t-shirts. Moreover, these organizations have a strong financial incentive to ensure that we succeed because their employees are on these deadly roads every day. For TraumaLink, these sponsorship fees will cover our operating costs and raise public awareness about our services. You've already heard about how we'll work, but now let me tell you why we are the team to do this. You know that we're passionate about this issue, but we also bring to the table years of experience in trauma training, emergency medicine, call center operations, and public-private partnerships. In addition, our board of advisors brings together luminaries in fields such as business, mobile health, and public health. No other organization in Bangladesh has the same partnerships that we do, and thus no other organization in Bangladesh is poised to succeed exactly like TraumaLink is. You might hear all this and think, great, but is it really scalable and self-sustaining? To answer these questions, I'd like to introduce you to Ryan Fu, our Chief Financial Officer.
Thanks, Eric. Hi, I'm Ryan Fu, CFO of TraumaLink. So why is our model scalable and self-sustainable? In terms of scalability, because of the many partnerships that we have, we've minimized training expenses. So the biggest cost item is call center operations. And beyond a one-time cost of setting up the call center, future expansions in terms of personnel and data collection will only be incremental. Therefore, even as we achieve national coverage for all 150 million citizens in Bangladesh, our annual operating cost will be only $500,000. We've also designed a model that is self-sustainable. Let me first quantify the revenue potential that these advertising opportunities represent. Consider the advertising spending of a top company in Bangladesh, say Grameen Phone. Even just 5% of the annual advertising budget of $12 million would be sufficient to cover our entire operations. And as we establish more sponsorships across multiple industries, we will generate surpluses for reinvestment. We are also actively exploring other revenue streams such as community-based financing and subscription services. Now, let's take a look at the projected financials over 4 key stages, from initial pilot all the way to international expansion. In the first stage, we'll require an investment of $100,000 to set up call center and conduct trauma training in a multi-village pilot with the purpose of testing our model and demonstrating our impact. In stage 2, by year 3, TraumaLink will reach 5,000 villages, establish our first advertising partnership, and achieve break-even. In stage 3, by year 5, TraumaLink will achieve national coverage, and our nationwide advertising partnerships would generate an annual revenue of $2 million, assuming 5 large companies, each channeling just 5% of the advertising budget through TraumaLink. This also corresponds to an annual surplus of $1.5 million, which we will use to strengthen our service model and also expand to other countries in the developing world. Before we proceed to implementation, we are also actively anticipating the risk that we need to manage in order to minimize the impact on our service. The first 2 potential risk factors are similar in nature. They include potential government resistance and lack of community buy-in. We do feel this risk are low because traditionally, Bangladeshi government has taken a hands-off approach to NGO activities, and our partners have a long history of working closely with the communities across a number of different programs. We will build upon those relationships and local knowledge and engage local government officials and community leaders early on and frequently. Third, potential friction could arise among our many partners, including ourselves. To minimize that possibility, we are now drafting detailed organizational activities and specifying the roles and responsibilities of TraumaLink and each of our individual partners. We will also formalize these agreements into legally binding contracts. With that, let me end our presentation today by summarizing the 4 S's of why you should invest in TraumaLink. Firstly, recreate substantial social impact. With our creative, innovative, and integrated model, over the next 5 years, we will deliver effective trauma care services to a nation of 150 million population, and we aspire to reduce annual fatality rate by at least 25%. Secondly, our model is self-sustainable that will be able to create long-term impact without a continuing reliance on grants. Thirdly, we have a strong team and partnership network that will allow us to work effectively with the communities to deliver impact. Lastly, we are also set to execute. We have already started utilizing the initial $5,000 funds to conduct our first trauma training in Bangladesh. Here is a pocket guide for trauma care training that we have already developed. With your investments, we will have the critical funds to proceed, conduct a pilot over the summer, and demonstrate our impact. And as you consider our proposal today, we urge you to remember the story of Amer. You have an opportunity today to change the lives of thousands of families like his who lose their loved ones every year. Let us work together to make TraumaLink a reality. Thank you.